Okay, so part two. So yeah, my boyfriend was like, you really need to get a second opinion. Go see a cardiologist at the hospital you train in. And so I did that, and I had a tilt test and some other tests, Holter monitors, can't remember what else. I also had orthostatic hypotension, like, pretty bad. And that test revealed, like, pauses and extreme bradycardia, like, low 30s and stuff. So, my cardiologist came out and was like, you're gonna need a pacemaker. And I remember just being, like, kind of shocked and just freaked out. Like, I don't know, like, it never occurred to me that it could be something that serious, I guess. I don't know. Like, I was on antiarrhythmics because I was having other arrhythmias as well. My conduction system was just a mess from the viral damage. And that has progressed I don't have an intrinsic heart rate anymore. Like, I'm pacemaker dependent now just because that damage progressed. But, yeah, so I got my first pacemaker in October of 98. And that helped a lot. Also the antiarrhythmics. So the main problem then was just the malabsorption, low blood pressure, and chronic nausea, along with the malabsorption, diarrhea, and stuff. And so I began to be afraid of eating, you know, because of the chronic nausea, like, as it progressed. It was just really tough. Okay, so then after that surgery, too, after my pacemaker implant, I had a lot of pain. And it turns out that something, like, my left shoulder joint got compressed during the implant. And, I had, like, bone issues and hormone issues, too. Sorry, I'm just waiting for those dogs to shut up. They're so loud, they're always barking, and I get so sensitive to noise. Anyway, yeah, so, I started having, like, really bad pain, and of course my low back pain, too. And then I was getting arthritic, like, my joints would just ache brutally, and anti-inflammatories weren't cutting it, and it was like a viral inflammatory arthritis. It's not rheumatoid. Like, anti-inflammatories weren't cutting it, and it was like a viral inflammatory arthritis. It's not rheumatoid, but well, that stayed with me. But the shoulder injury and the low back injury were the worst. And actually, the shoulder, I'd gone to see an orthopedic surgeon on referral, and he basically told me that for the condition I had, like, I lost full range of motion, and also, like, you could feel, like, a pop in there, and grinding, crepitus, and stuff. And he was saying, well, we could go in there and scrape out the joint capsule, but there's no guarantee it will work. And I was like, no, I'm not down. Like, if you don't even know if it's going to help, that sounds like a pretty brutal surgery. So I declined that. But my primary sent me to see a physical therapist at that point. Mostly, like, alternating hot packs and cold packs, deep tissue, like, trigger point release, because I had so many, like, horrible knots in my muscles, like neck and shoulders and upper back especially. And it was my PT who brought up pain management and was like, honestly, I'm not comfortable working with you until you have some better pain control, because it was really, like, I was in a lot of pain. So I went back to my primary and did a trial with different pain medications, like adjuvant pain medications, everything besides opiates, because at that point I was already indoctrinated into that clinician opiophobia thing where, like, I don't know, it's just frowned upon, I guess, in the profession. So I just was very, like, not comfortable with the idea of going on opioid analgesics, but eventually, like, the pain was just unbearable and the other drugs were not cutting it. And so I went to pain clinic, like, reluctantly, after, I think it took me like 2 years to agree to go. I'm trying to remember. It's so bad, my chronology, and my memory is just nothing anyway. So I apologize for all the, like, pauses and ums and not sures. Yeah, so I started on hydrocodone at that point, and it helped a lot. And then, but my shoulder didn't improve. But at least I was getting pain control, and I remember my anesthesiologist saying, like, there's actually anatomical damage here. This isn't gonna go away. And I kind of felt fortunate because there's so many people with chronic pain that there isn't an identifiable pathology. And my heart goes out to those people so much. Anyway, so yeah. And then I eventually got on, like, longer acting opiates, like sustained release oxycodone. And then ultimately got put on the fentanyl patch, which was, like, revolutionizing for me. Like, that drug really restored me to functionality. It was really great. And I'm still on it now, and I've had really good results with it. But my husband and I are wanting to get pregnant, and there's a lot of prep work going into that, but one of the things I need to do is get off my pain meds. So I've been tapering for about a year. It's been really tough because my body is, like, so compromised by chronic illness that the stress of reducing that medication and enduring the extra pain has been very, very hard. So I've reduced my dose significantly, but I'm really struggling now, and I'm not sure. I'm kind of at an impasse because living with this pain is just too much. But I'm not willing to give up my dream, so it's like a difficult, tenuous, like, impasse right now. So yeah, earlier in the month, or last month, my doctor had said, earlier this month, my primary and I decided to just have me hold at this dose for a while and not continue the taper right now. I had gotten impatient and tried to rush it early in the year and went through really bad withdrawal symptoms and, like, rebound hyperalgesia and stuff, so it was just not good. And I've talked about when I got converted to the patch. That's like a horror story that I might do another video on sometime, but it was very traumatic. I got switched the morning before thoracoscopy and woke up in excruciating pain because the patch hadn't kicked in yet. It's a long story, but very traumatizing. I'll never forget that. So then in November, I have to back up again just to go on to the next issue. In November of 98, I was ironing my clothes one night, or no, 99, I guess. Yeah, 99. was ironing my clothes, and my feet were really itching, you know. And I looked down, and like my ankles and feet were so swollen, and like I had pitting edema and just like fluid retention, and I had just become more progressively run down and stuff. But with the CFS, it's kind of hard to differentiate between like degrees of fatigue. You never know, is it just because of the CFS or is there something else going on? But it turned out that I was in heart failure, experiencing symptoms of heart failure. And then in February of 2000, I was diagnosed with heart failure, cardiomyopathy. And so it's just crazy what this one little virus did. So the good news is I've outlived my prognosis. I have an excellent physician now. I have meds that I need, stuff, but the malabsorption has been so bad, and coupled with like issues with being afraid of eating because of the nausea, like I just couldn't handle it. And I do have IV nausea meds around the clock, like I have to. I wouldn't be here today if it wasn't for antiemetics. So, you know, thank God for that. I have like IV meds to help me, and I've been able to stabilize, but I have intermittently needed TPN because of being so underweight. I've been doing well for a while. For the past couple weeks, I've been having really bad malabsorption symptoms again, though I don't know why. Sometimes it's worse than others. I don't do well with change in weather either. But yeah, I finally got so sick that I had to leave university, but not until I had, you know, it was my 5th medical leave. I just wouldn't give up, and even though I should have given up a lot sooner, I just didn't, and had to admit defeat in November 2001. So I basically came home to die. You know, I had a bad prognosis, which I've outlived. Yay for that. Yeah, it's hard times, you know, dealing with this stuff. So yeah, this is just kind of the medical progression video. Like, I have more in-depth, longer videos about all the surrounding life circumstances and stuff, but it's just like an overview of how my illness has developed and what's going on. But yeah, I just wanted to kind of explain, because I've been reaching out to other patients. They're probably thinking, like, who is this girl? Why is she talking to me? Yeah, I can understand because of things that I go through too, even though I don't have the same presentation as a lot of you. And also just because of my clinical education, I figured, like, I've been working as a patient advocate since I left school. I figured I should utilize my knowledge to help people. So that's kind of one of the reasons I've been vlogging more about my health too, to reach out to you guys and see if I can be a communicative liaison for any of you with your doctors, or help explain, like, what's going on, or we can talk about potential therapies for what you're going through, or whatever. I'm totally here for you guys. You know, I'm disabled, so I have very little life, and if I have any energy, I usually will be spending it online. Yeah, but I guess, like, since I've been struggling more with my illness, I've just felt the need to reach out again with everything. And if you guys aren't, it's just that I'm sorry, because I know my channel has had tons of pet videos for the most part. So if you watched all of this, thank you. And again, if you have any questions, please feel free to ask. I'm very open book. I don't mind sharing about it. So, be well, precious ones. Much love, and I hope everybody's doing okay. Bye, guys.